Marianne, you have a number of different exciting products here that we can use at home to further our dental health care. Tell us about them, please.
Okay, well, some of the things we've already seen or you're already familiar with, like a regular toothbrush.
Right.
This is what most people use, and it can be very effective if it's used properly. Problem is most people don't use it properly.
And Marianne, we see too that you have your choice in the store, whether you want soft or you want more firm. What's the best thing to use?
Thank you for asking that, Valerie. As dental professionals, we always recommend soft because you don't want to be too hard, especially on the gum tissue.
Right.
The gum tissue can be, you know, rather sensitive and fragile. So, and all you're trying to get off with a toothbrush is plaque. And plaque should come off very easily.
Okay.
So there really should be no need to use anything harder than a soft toothbrush.
Okay.
It's
That's
usually, yeah, it's usually a matter that people aren't using it properly.
Right.
That makes them want to use something harder.
Okay. Okay. And what are some of these other things?
Well, we have a variety of products here. Some toothpaste samples that we tend to recommend. These here are product samples of toothpaste made for sensitive teeth. This is a complaint that many patients have. They have sensitive teeth, hot and cold bothers them.
Right, okay.
And so this can help decrease sensitivity levels in their teeth.
Yes.
And then the Biotine, this is a really wonderful product. Many patients have problems with dry mouth.
Exactly, and I see this as a special toothpaste for that. Would that be dry mouth during the day or at night?
Anytime,
Really?
anytime. A lot of medications can cause problems with dry mouth.
Sure.
There's certain diseases that cause issues with reduced saliva flow, and so having something that helps lubricate your mouth and
allergy medicines come to mind.
Yes.
Dry mouth.
Yes.
Yes.
Also, this product here, Oasis, is a great mouth rinse for people with dry mouth. It also helps alleviate some of the issues with that.
So interesting. I had no idea that there were products out there for dry mouth.
A lot of products out there.
Yes.
We only have a few here because we would be here for hours if we had to touch upon all the different dental products.
Really?
An amazing number of products out there. And then here we have some samples of, or examples of floss. This is one we've been recommending more. These are little flossers, and one of the complaints many patients have is they can't get into their mouths. Maybe some men have very large hands, or maybe dexterity is an issue. So these little pre-threaded flossers can be effective. You just need to push and pull so that they're against the tooth surface, wrapping against the tooth surface so you can get down below the gums.
And how do they work? Do you replace the thread in them, or are they disposable?
These are disposable, but certain manufacturers do make holders where you can thread your own floss in them. You just need to go to your local drugstore and look for, look in the dental aisle, and you'll see all kinds of different flossing aids. And then these are just different types of floss. My favorite is the woven. It's very grippy, really helps pull out all kinds of plaque and debris. And then this is a new one that has just come out. It's looking very intriguing. It's kind of a mix between a glide, which many people really love, but we found that people don't do as good a job with glide as they might with a woven or a wax floss. So this is kind of an in-between kind of product that looks very promising. So
is that like a satiny finish on it?
It's almost, it's really neat. It's kind of like a rubber band.
Oh my goodness, look at that.
It's, so you can kind of see it has a stretchy quality.
Look at that.
It has a slight amount of abrasiveness on there, so it will,
yes, I feel it.
You feel it? Yeah, so it will grip, you know, debris in between your teeth and pull it out.
Let me ask you too, on the subject of flossing, I've seen those little handheld, battery-operated little picks that you can get in between your teeth and down into your gums. How do you feel about those?
Well, it all comes down to, are you getting the results? So if it's giving you the results, then I'm okay with it. And a lot of those things are very technique sensitive, so you just need to make sure your technique is proper. Now, if you have something like that and you don't know if you're using it properly, you can always bring it in with you when you get your teeth cleaned, and we'll be happy to review.
Good advice.
Yeah, we often actually recommend our patients bring their Sonicares in.
Very smart, very smart.
And we'll show them how to use them properly.
Yeah, good. Education is everything.
Everything, yes. And then back here we have a couple of other products that we like very much. One thing that is kind of a neat thing to do is to use a tongue scraper. Now you can use a toothbrush and brush your tongue.
Right.
This is something that doesn't often get talked about, but your tongue needs to be cleaned also.
I think a lot of us don't even think about that.
Right,
you know?
That's pretty common.
Yeah.
But I always like to think of your tongue as kind of a shag carpet, and it needs to be vacuumed.
That's a good way to put it.
And so you got to clean it.
Yes.
And so you can brush it. You could take a little toothpaste and brush your tongue. You just stick it out and give it a good brushing. Or they have these nifty little gadgets called tongue scrapers. Now there are products that are formulated to help lift the plaque out of your tongue. This gel is one example of it. So you just apply that to your tongue prior to using.
And it's plaque that gets into your tongue?
Yes.
Never heard of that.
Yes. Well,
Never.
plaque is bacteria, and bacteria live all over in your mouth. So.
Yeah.
And you can also use Listerine. Listerine is a good antiseptic. You can buy it anywhere.
Sure. Tried and true.
And then this bottle next to you is a version, it's a form, there's lots of different brands out there. It's what we call chlorhexidine rinse. It's a prescription formula mouth rinse. You either get it through your, through a prescription or we can dispense it here too.
Okay.
And we use this mainly after active, during active deep cleanings because it helps the gums settle down faster and heal faster. It kills bacteria without the burning sensation that the Listerine can give.
Right. Good information.
And then back here, Valerie, I'd like to just also talk about this product. This is a really, we love this product. This is like a gel anesthetic. It's like a gel Novocaine. So it's extremely appropriate for deep cleanings.
Really?
So if people don't want to have an actual injection,
yes,
they can
now
just,
you're talking.
Yes. The hygienist can just squirt this around the teeth, and it gives great soft tissue numbing. So the gums get nice and numb, and it lasts for about 20-30 minutes. It lasts long enough for that area of your mouth to get nicely cleaned, and then it wears off.
So you're not dribbling and dealing with the side effects of Novocaine for a couple of hours
this is
afterwards.
really, especially for anybody who has issues with the needle, this is a great product.
Or if you have to go right back to work.
Right, yes, another great use for that.
You don't want to be on the phone.
Right, yeah. So this is we really like this product a lot. And then of course, this particular toothbrush, the Sonicare, is my personal favorite. I think it just does a phenomenal job of helping people keep their teeth clean.
Yes, and you're going to be giving us a demonstration on how to properly use that.
Yes, because it is very different from using a regular brush.
Yes, I think